So at this age, there's a lot of new things that are confirmed are very important, changing the landscape of oncology, the impact of novel therapy, but it's only a big chapter that is being written about the use of immunotherapy, in particular checkpoint inhibitors and cell therapy with CAR T cells. But the checkpoint inhibitors, here we had an update, particularly in Hodgkin lymphoma of nivolumab and pembrolizumab, and showing that a very durable response in excess of 2 years, including in some patients who actually had stopped therapy and had durable response afterwards. It was interesting to see that there's also a small number of patients, for sure, that were actually relapse after having stopped the therapy and were retreated with still some benefit. So we are learning on how to define on how long we have to treat those patients. What was interesting in that study, this was a heavily pretreated population, primary failure, or patient who had failed high-dose therapy and prior bone marrow transplantation. And the response rate, depending on the category, was between 45 and 75%, with a significant number of complete responses in that setting. Pembrolizumab was well tolerated in that population, and it offers a platform for combination. So they were also, during that same session, presentation not with Pembro, but another checkpoint inhibitor in combination with antibody-drug conjugate, and they will be also done in the combination with chemotherapy. And this offers us a new platform to try to offer very durable response in patients with a small fraction of patients with Hodgkin lymphoma actually do poorly. 20-25% when they relapse do actually very poorly. So having new options and very sustainable response is very appealing. It was also an interesting aspect, so since it is an immunotherapy, we're trying to understand a little bit the mechanisms of action. So there was an attempt to look at biomarkers, particularly looking at T cells and NK cell changes that are happening on treatment. So there was an increase of NK cells and T cells activity while the patient were on pembrolizumab, particularly in the responding patients. So as we understand this better, we'll be able, hopefully in the future, to try to identify the subset of patients or the duration of treatment that we need to provide to this patient. And finally, briefly, this is also starting to be applied in multiple myeloma, and we were part of that study as well, in combination with lenalidomide. And this also provides a new platform in multiple myeloma that has really shifted away from chemotherapy to combination biological, but not really until very recently trying to tackle into the immunotherapy field, also in multiple myeloma. So altogether, pembrolizumab and other checkpoint inhibitors are starting to really open a chapter that will really have an impact in lymphoma and myeloma.